Check. Let us make sure I am sharing the right thing. Yes, I am. Bring this over. And I'm, like I stated, when you look at your independent review, it stops at number 24. There's no pathology. So I'm gonna go over these pathologies. But I'm just gonna pretty much breeze through them. They should not be the focus of your studying, because remember, this is anatomy and physiology class. Pathology is secondary. The normal has to come first.
I have a question.
Yeah, shoot.
People with blood type are universal donors, are type A?
Blood type. Who's the universal donor? Blood type O. And if you know one side of the coin, what's the other side of the coin? AB, right? So that's how I always remember. Donor, donut, they don't have any antigen, therefore they can't start any trouble, therefore they can give their blood to anybody. And those of you military personnel, what do you always put? Who's always in the rear with the gear? Two different personnel. You always put the doc in the rear, and you put anybody with type O blood in the back. They'll never be on point, and they'll never be up front, because that's your universal donor, just in case bad happens. So let's go over these disorders, and a lot of it is medical terminology powers. So if we look at bacteremia, viremia, that's what? Bacteria. And viremia is emia, blood condition of viruses. Septicemia, when something is septic, like what do we have in a septic tank? Feces, garbage. So if I have septicemia, what do I have in my blood? Garbage. Problem is, where does my blood circulate? It circulates everywhere. So now I got a ton of garbage where? Everywhere, and it's multiplying. And you guys, I told the story of cowboy, right? No? Some of you looking at me, no, he did not. I still have extra stories. Septicemia, I had a patient, cowboy, comes in 10:30, he's on a business trip, and he's from the lovely state of Texas. And of course, he's got the boots, he's got the hat, and he's got the rodeo belt buckle. He is a living stereotype of Texan. Lovely man. 10:30, I found he had a 2-centimeter bleeding ulcer. So we do something, we stabilize him, everything's cool. Around 12:30, I go, he's cool, I'm just gonna get a sandwich. I go to Burger King, I come back. How long does it take to go to Burger King? 15 minutes. He came back. He had septicemia. I didn't see it, because what happens in your stomach? Doesn't it have a lot of arteries and veins in there? And there's a lot of dirtiness in that stomach. And now there's a hole in it. Well, it spread to the blood. He coded around 12:30, quarter to 1. I tried reviving him, and then I called it around quarter to 2, deceased. 34-year-old man.
But if you knew the ulcer was in his stomach, why didn't you think the next thing he would be?
No, we took bloods, and then I saw on his differential, I didn't see a lot of signs of septicemia. I saw the infection, but he didn't have a high fever, no chills, and of course he's young. But then, of course, I went out for a sandwich. Did you think the chills came? Do you think the high fever came? Yep, it came fast, then he coded. Because remember, septicemia, where is now the bacteria? It's everywhere. And unfortunately, he's a smoker, he's a drinker. He went to kidney failure rather quickly. And I just remember Cowboy. I just remember he was just a cool dude, and such a shame, because in not even 3 hours he died. Malaria. That's nice to know. Anemia, we already know. Sickle cell, of course. When the hemoglobin starts looking all messed up, so does the red blood cell. It's no longer a biconcave disc. It looks more like a sickle, or like that big knife, or the big thing that cuts wheat. Hemolytic anemia. That means your blood is going to start breaking down. Iron deficiency, of course, very common in pregnant mommies. Oh, pernicious anemia, vitamin B12 deficiency, very common with addicts, and of course with malnutrition patients. And aplastic anemia, very common in cancers, especially where bone marrow does not produce enough red blood cells. Remember we talked about leukemia? Leukemia is a white blood cell. Where's my white blood cells? It's everywhere, isn't it? So if I have leukemia, where's my cancer now? Everywhere there's blood. Isn't there a whole ton of blood in my bones? Right? I told you guys the little girl kicking the soccer ball story, right? No, you guys don't remember? I'll save that for another one. She had aplastic anemia too. Thalassemia, red blood cells look awkward, just like sickle cell. Hemophilia, that's a blood clotting disorder. Oh, this is kid I grew up with, Gerald. I felt so bad for him because he couldn't play with us. And if you guys know anything about the 70s, kids played out in the street and did quite dangerous things. And my poor friend Gerald, he had hemophilia. That means he had a clotting disorder. So he bruises up really easy. Don't you think his bruise can be a thrombus, can be an embolus, and then maybe he gets a stroke or heart attack? Yeah, so he could just, I just remember him just watching on the stoop, watching us play and just get, just be rambunctious. So that becomes quite dangerous if you have a clotting disorder. Hyperhomocystinemia and not too common. Too much clotting, right? Thrombus is an abnormal blood clot that stands still. An embolus is a blood clot that moves around. Either one, risk of stroke, risk of pulmonary emboli, risk of myocardial infarction. And what's a myocardial infarction? Is a blockage of your heart. And I don't want that because what am I going to get right after I get that heart attack? I'm going to get a cardiac arrest. I don't care about the heart attack. The AMI doesn't scare me. It's the sequelae or what happens next. The sequelae of a heart attack is heart failure or cardiac arrest, and we don't want that. Leukemia, and again, I'm just going to breeze through these because not as important as the other stuff. You had myeloid and lymphoid, right? Oopsies. And of course, if you have leukemia, that is a cancer. Now, if you guys recall, what is cancer? Cancer is an abnormal cell that just keeps on dividing and just keeps on making more of it. Now, we all know that if you keep on photocopying the photocopy of a photocopy of a photocopy, how's that copy after a couple of thousand shots? Is it anything useful? No, and that's what cancer is. So for example, let's say you guys are all normal cells. What's cancer? Let's say I put 100 more people in this room who have nothing to do with healthcare. And I told them, you're allowed to do whatever you want. So what would they do? Now, let's say I only ordered 20 box lunches. What's the cancer gonna do? Don't you think they're gonna eat our lunch? And if there's 100 more people in it, what's gonna happen to the seats? Don't you think they'll break? What's gonna happen to the walls? Don't you think they'll break? And if they keep on making copies, so in the next hour, there's not 100 people in this room, there's 200 people in this room. What happens when this room fills up? Don't you think that glass will break? And then it'll go outside? Don't you think this door will break? And then the cancer will go outside? And when the cancer moves, that's called metastasis or Mets. So you can see now how dangerous cancer is. It's a cell that just keeps on dividing and it doesn't do anything. So all it does is eat and all it does is break stuff. So now you can see how debilitating a leukemia is because it's a white blood cell that's not protecting me. It's just eating up all the energy of the rest of my white blood cells. And how's my blood flow? Just like traffic, don't you think? If I had a white blood cell tumor, now I'm going to have a whole bunch of white blood cells. What's going to happen to the traffic? Don't you think the blood will get thicker and move thicker and move slower? Isn't that a problem? It's a big problem. So right off the bat, I'm just looking real quick. What should I accentuate for the next is the heart. So when we go into modules, where is my modules? There it is. And then when I go to unit 1, which is this week, lecture and additional sources, I'm going to download unit. Now, after we do this, we're going to look at some of these heart videos, because just like my lecture, it's incredibly boring. No matter what I do here, you're going to sleep. Lights on or lights off. So I'm going to also teach you how to extract information from a video you don't like. Because honestly, is any video that anyone makes for education Academy Award winning and will has got Brad Pitt in it? No, you don't have Brad Pitt, you got me. So you got to go deal with it. And how do you deal with it? Again, the active listening. That's why I looked at this real quick. Deoxygenated blood, what the layers of the heart, ECG, right off the bat, I'm doing what? I'm soaking in, which is a tactic for your board exams. Everybody in this room is going to have to take some sort of licensure exam. And many times it's what? It's some sort of clinical vignette or clinical story, and then they have some questions related to it. So what can you do? If you know the questions in advance, then your brain can focus on what's important. So let's show what's important. So cardiovascular. So cardiovascular means what? Not only the heart, but all the tubing, God bless, that's connected to it. So it's not only the heart, but the blood and blood vessels. This is all part of the cardiovascular system. 10,000 a day, pulmonary, systemic circuit. Now, did we just see, just by briefly looking at our review questions, that you needed to know which one's the blue side and which one's the red side? If you look at pictures and diagrams of the heart, you'll see that it's covered blue and red. But how many of you all seen a real heart? Nobody? Right? Well, because if we have some time, I can't promise nothing, right? I'm gonna bring you guys down by groups, and if we have some time, we'll mess with the anatomy, so I can show you what a real body looks like. And in a real body, there's no red and blue, but we have to color it red and blue so that you know and understand what side is what side. So blue is deoxygenated, means that the red blood cell is carrying more carbon dioxide than oxygen. And red means that the red blood cell is carrying way more oxygen than carbon dioxide. So the pulmonary circuit is typically the left side of the heart, right? And the systemic circuit is the right side of the heart. So the left side deals with blood that's going in and out of your lungs. I'm sorry, scratch that, erase. The right side is, you know what? Instead of me just pointing at my own chest, let's look at this picture. This picture. So when we're looking at the heart is a 4-chamber muscular organ. And if you look at the left side, now, remember, especially the radiology technicians in the room, also the surgical techs as well. When you're looking at your patient, you're looking at the perspective of your patient, not your perspective. So where is the right side of my patient's heart if they're looking right at you? It's over here. Where's the left side? Over here. The left side is the systemic side. It is colored red because the majority of the red blood cells on the systemic side are oxygenated. And it makes sense because if my heart is going to pump blood out to my systems, don't you think it should have oxygen in it? Now, the blue side, which is the right side, that's your pulmonic circulation or your pulmonary side. Now that has to be deoxygenated because what am I doing? I'm taking blood from the rest of my body, right, which is already used up. And when it's used up, it's got a lot of carbon dioxide. And what's my lungs going to do? It's going to exhale carbon dioxide. And then what is it going to do? It's going to suck in oxygen. And then the whole process starts all over again. So this is a nice picture to remind us that the circulation of the heart has two sides. Left side, systemic, right side, pulmonic. Right side, deoxygenated. Left side, oxygenated, which is a lovely
You called one the pulmonary and the other one is what?
systemic.
Oh.
So this is pulmonary because it's going in and out of the lungs. And this one's systemic because it's going to go out into the systems, which needs oxygen. So that's what this is. Where's your heart located? It's about the size of your fist, located a little bit on the left side of your thoracic cage. Thoracic means your chest. It's surrounded by covering. And hey, wasn't that a question on our review questions? What are the layers of the heart? So right off the top, I've got layers. Peri, what does peri mean? Medical terminology, people. Peri means what? Surrounding. So that's got to be the outer layer. You have the visceral, the pericardium, also known as the epicardium. Right? So the epicardium means what? Right on top. So you have the pericardium, then the epicardium, right? And then you will have your visceral and parietal layers of your heart. Now, I know this is going to kill you. This is backwards. Because what's your viscera? Your viscera is your guts. So where's your guts? On the inside or outside? Inside. So the parietal layer has to be outside. So what are the layers? You have your pericardium on top, right? You have your epicardium, that's the next layer. Then you have your parietal, and then your visceral. So the visceral is the deepest part. Now, why do we care about the visceral and parietal layer? Because in between the visceral and parietal layer, there's something called serous fluid, and the function of that fluid is to reduce friction. Think about it. This thing's been pumping ever since the 8th or 9th week age of gestation, even before you were even born. 31 weeks even before you're born, this thing's pumping and causing friction, because anything that moves makes what? Friction. So you have your visceral and your parietal pericardium. In between them is the serous fluid, and it reduces the friction. So what could we ask you? Layers. We already know our layers. Where's our heart? It's in the thoracic cage in a place called your mediastinum. Media means what? Middle. Sternum looks like the word sternum, which is your breastbone, right here. And it's a little bit to your left, right? Oopsies. Pericardia, we already had that. See these layers? Okay. This is nice. And let's talk about the deeper layers. The myocardium, myo means muscle. And what's the layer on the deepest layer? That's your endocardium. So if you have myocardial infarction, right, which is a heart attack, pieces of these layers are gonna get affected. So if I had maybe up to here, it's okay. You'll probably be in the hospital 72 hours, maybe go home on day 4. But if the infarction or the damage goes all the way into the myocardium and into the endocardium, are you going to go home anytime soon? No. If it's transmural or it's all the way in, you're in a lot of trouble. You need a brand new heart. Okay? So know your layers, okay? Which is on the outside and which is the deepest, which is where? Endocardium. Deepest part of your heart. Now this is craziness. It's hard to remember all of this stuff. What's better? Let's go look at things simply first. Look at this. And I'll also put a video because some of you are, surgical techs and may be interested in cardiovascular surgery. So you're going to need to know how these parts go together. And I have another video, not for the other class when I teach the RNs, they get tested on it on on the cardiac cycle, so they got to know it. But oh, hey, why don't you look at it? But if we're looking at this, there are chambers of the heart, and of course we already know this is the left and this is the right. The smaller rooms or the smaller chambers on the top are called your atria. The larger ones are called your ventricles. And a septum is anything that separates right from left. Like this thing right here in your nose. This is your what? Nasal septum. It's separating your right nares and your left nares, also known as your nostrils. Well, you got a nice little separation here. Your interventricular septum, which separates the left ventricle from the right ventricle. So this is the right atrium, left ventricle, right ventricle. And these little flap things are valves. Okay? So let's leave it at that. Next. Now, we already know the pulmonary circuit and the systemic circuit. Now, let's go into a little bit more detail. Why do we call it pulmonary? And why do we call it systemic? So, this is your superior vena cava, this is your inferior vena cava. And if you look at the word vena, it means vein. That means it's coming back towards the heart. Veins typically are blood vessels that go back to the heart. And arteries are typically things that go away from the heart. So if you can see here, your superior vena cava is all the deoxygenated blood from your head. And your inferior vena cava is all the deoxygenated blood from your neck on down. And it has to come back to the heart, hence the veins. So it goes in here, the right atrium, through these valves, that's your tricuspid valve, and then into your right ventricle. Out of your right ventricle, it goes into your pulmonary artery. Now, you see the pulmonary artery? It's going where? Left and right. Because remember, I have my heart is in the middle, right? So where are my lungs? Left and right of your mediastinum. So, and remember, this is pulmonary circulation. So it's deoxygenated carbon dioxide that has to go to my lungs so that my lungs can do what? Breathe out carbon dioxide. And what do I do when inhale? Almost choked my own. So when you oxygenate it, now it comes back to the left atrium, goes through the bicuspid, also known as the mitral valve. Then it goes through your ventricle, then into this big artery called your aorta. So the aorta is that big artery. It's red because it's oxygenated, because I need that blood to go where? To my rest of my body. That's why if anything ever happens to your aorta or any of these great vessels, how much more do you have to live? You guys ever watch TV shows when they're talking about aortic aneurysm or aortic dissection? Like, oh my God, it's an emergency because this thing is under high pressure. What if I nicked it like this? Don't you think it'll open up?
That's why pregnant women aren't supposed to sleep on their back.
We try because in pregnancy we try to have mommy sleep on their side, because if we sleep on their back, the abdominal contents will start pushing up against her lungs, and then it will start decreasing lung volume. And if you mess with your lungs, we already know that your heart has a pulmonary side and a systemic side. So let's say, for example, I have chronic obstructive pulmonary disease. I have emphysema. Don't you think I'm going to have a heart problem too? Remember, just because we learn things in different chapters, no one understands that all of these things are connected. So if you mess with one thing, like Cowboy Man, right? They called him the Marlboro Man because he looked like the Marlboro Man, classic Texan. It was a GI problem. Of course, they sent it to internal medicine. That quickly became a what? A infectious medicine problem, and then he had kidney failure and then heart failure, which became a nephrology problem and then a cardiac problem, all within what? An hour or two. So you could see here, the heart is a muscle, and the muscle needs to also be supplied with arteries and veins. Those arteries and veins are called coronary arteries, coronary veins. And you see this heart, it's this big, right? Your heart's pretty much the size of the fist. So you can only imagine how small these blood vessels are. How easy. This is your left anterior descending artery. Most common artery around anywhere from 45 to 60% of the heart attacks happen here. It's about less than 1 millimeter thick in real life. So it doesn't take a lot of Doritos and Miller Lite to cause a problem there, can it? And if any of you Google, go on YouTube and look up open heart surgery, you can see the heart is what? Full of fat. All it is just one big thing of fat. But when you teach it, you got to remove all the fat, remove all the covering so you can see stuff. So coronary arteries and veins, those are the things that supply the heart itself, because the heart itself is a muscle. Pulmonary vasculature, and we already know what the vasculature is. All the arteries and veins. And we're going to talk about, excuse me. Thank you. We're going to talk about the differences between arteries and veins. We already know the chambers, okay? Now, let's look at the valves. What's a valve? Better to look at it like this. What's a valve? A valve is simply a door. And in our heart, if you notice, blood only goes one way, right? It only goes from top to bottom and then out. Did you guys notice that? And hence the term cardiac cycle. So if you have an AV valve, and what side is this, right or left? What side is this, my patient, right or left?
Right?
What am I waving at you? So that's right. Is it pulmonary or systemic? Pulmonary. So right atrium, right ventricle. This is an AV valve because it's going in between an atrium and a ventricle. And the AV valve on the right side is called your tricuspid. You have the same thing here on the left side. The AV valve between your left atrium and left ventricle is called your bicuspid, also known as your mitral valve. Okay? Now, before it exits the ventricle, this is the pulmonic side, yes? Deoxygenated. This has to go to where? Lungs. So this has to be the pulmonary semilunar valve. This is the systemic side. It goes up into the aorta. So this valve right here has to be the aortic semilunar valve. So now that you know that, this might be a little bit make more sense. So AV valve, think on the right side, it's between the atrium and ventricle, tricuspid. On the left side, bicuspid. Now the semilunar valves are a little bit weird looking. They look like ashtrays. These have cords, look like parachutes. You can see it here. It looks like a little parachute. But these, I had a student more than a decade ago. That guy looks like ashtray. So now I always look at semilunar valves like an ashtray. But when you really think about it, a semilunar valve, if you look at my hand like this, doesn't it look like a crescent moon? Now, let me put two of them together and do this. That's a semilunar valve. And they both exit ventricles. And of course, the pulmonary valve has to go to where? Lungs. So that's got to be the right side. Aortic valve goes to the aorta. Systemic, that's got to be the right. And there is no backflow. Blood only goes what? One direction. When blood starts backing up, that's called regurgitation. That's a problem. And then you're going to have what? A murmur. So a murmur is just simply an abnormal heart sound. How many of you have a stethoscope at home? You took it and what the first thing you did to it? Right? I want to see if I'm live. Right? Maybe I'm a vampire. Maybe today's the day I find out I glitter in the sun. Who knows? Right? I put it on, and then when you put it on your chest, what did you hear? Lub dub, lub dub, lub dub, lub dub. Consistently. You heard two sounds, a lub and a dub. Lub, that's your AV valves closing. The dub, That's your semilunar valves closing. Now, if I had a murmur, which is an abnormal heart sound, don't you think the lub dub will sound funny? It'll sound like lub dub 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 dub, an extra, and that's called an S3. Or if I had a machinery murmur, which is typically a tricuspid, that's when you have regurgitation or backflow. You'll hear sh dub, because the first doors aren't closing all the way. So if they're not closing all the way, what's going to squirt out? Blood. So my doors close. Instead of lub, you'll hear what? That's not good, right? And especially those, if you hear it on the right side, that's your tricuspid valve. But what do you need to know? Just need to know that what? Murmurs are abnormal heart sounds. And the right side is pulmonic, left side, circulatory. AV valve on the right side, tricuspid. AV valve on the left side, bicuspid. And of course, the valves exiting to my lungs, pulmonary semilunar valve coming from my right ventricle and my aortic. And you see this big aortic arch. See this thing here? You got to use your imagination that it goes underneath it. And that's your aortic semilunar valve. Oh, this is AV valve. You see how they have, they look like parachutes? And what does a parachute have? It has cords. And there's these little muscles here. They're called your papillary muscles. But know that this is actually how, it's like an upside down parachute. Your AV valves, when blood comes in, right, what's going to happen? It's going to cup like this, right? So do you think blood's going to go down? No. But what happens if I had some cords, which is the chordae tendineae, I pull on it and I do this? Then the blood will do what? It will go down. And can the blood go back up? No. Blood can only go from atrium, the ventricle, pump, and then out. And let me show you, before we get to the next video here, let me show you a lovely video of EKG. I got my mom tickets for this game. Crazy expensive. I don't want to. Now, this stuff in yellow, that's all the impulses, all the electricity. If you recall your anatomy physiology 1, what makes the muscle contract? You have to have a signal from your brain that sends it to the nerve, and the nerve impulse will tell what? Your muscles to do what? Get smaller. All your heart is a muscle that has to get smaller, but it has to do what? It has to contract in rhythm. Anyone ever go to the old-timey farms, right? And then you, when you have to pump no, not butter. You got to pump for the water. If you go really fast, does any water come out? Not much. If you go really slow, does any water come out? No. But if you pump all the way up, all the way down in a rhythmic cycle, what happens to the water? The water then flows. Now, that's what has to happen. Now, if you see this, there's a way I can loop it. If you look at this, look at the blue and the red. Where does it always start? It always starts at the top. If you look at the blue and the red, it's starting at the top. Where's it going to go? Down and out. And do you see? Wait, let me catch it at just the right time. Blah, 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 blah. Right there.
So that's
When these things close, these are your AV valves. This is, of course, your bicuspid. This is your tricuspid. This is your pulmonary side. This is your systemic side. When those AV valves close, you have what? S1. That's the lub, right? And then, you see how it's going out now? This is blue, so that's coming from my right ventricle, so that's got to be my pulmonic semilunar valve, and this one's going into my aorta, and that's got to be the aortic semilunar valve. And then when they close, they make the S2 sound. And you can see there, all of it relates to what? The electricity or the EKG. So, and you know an EKG, you don't even have to be a tech to know that if it goes like this, there's something wrong. But if it's like this, then you know it's what? It's NSR, or normal sinus rhythm, right? Doesn't take any medical training to know that, but now you know exactly why, right? So I think that's also another reason that you can add on to the reasons why you want to do this, because I went to Fordham University. I thought I was going to go to law school. All my fraternity brothers except me went to law school. And I switched to chemistry because now I know exactly how the world works. You know what I learned out of 2 years of political science? I learned that the more money I have, the more that the rules don't apply to me. But the more I stayed in biology and chemistry, I learned that no matter how much money you got, you cannot violate the rules of science. They will always be the same, no matter who you are. And that's what's awesome about healthcare. You can have some highfalutin doctor from Harvard, right? If they don't know their anatomy and physiology and don't look at the basics, you're not going to get better, right? But if you have somebody from, Dumbledore University who barely graduated, but they know their anatomy and physiology, then you have stuff. So you can see how also we actually define the ECG, right? Ooh, I accidentally defined lub-dub. Now, what's systole and diastole? We all know that our blood pressure. What's a normal blood pressure that everyone knows? What's the goal of America, but we'll probably never reach it because there's way too many Doritos in the world. 120/80. So what does that really mean? 120 is your systolic blood pressure, right? 80 is your diastolic blood pressure. Now, systolic blood pressure means, remember when we saw the heart? Did you guys notice that the heart went lub-dub, and there was like a kind of a rest? Did you guys notice that? It went lub-dub, and then there was like a space. And then the next one, lub-dub, then a space, lub-dub. So when the heart is pushing out stuff, especially the ventricles, that's my systolic blood pressure. It's measured at 180 millimeters of mercury. Because back in the old days, the way we measured pressure was we put mercury in a tube, and if water pushed anywhere, it would move the mercury 180 millimeters, or about 18 centimeters. If you've ever seen the old-timey aneroid, even the old-timey aneroid blood pressure cuffs, that's not mercury. You get mercury like in the 1930s, 1940s, and mercury is neurotoxic. So if you ever had it like an old-timey thermometer, do not play with it. It's a great way to get Alzheimer's and a whole bunch of nasty things. So systolic means the heart when it's pumping. And remember, there was a little break, because there has to be a break, because don't you think the heart has to fill up, and it takes some time to fill up? A couple of milliseconds. But that would be my diastolic, or the lower blood pressure. And they're kind of close to each other. So now when your patient asks, hey, what does this mean? My blood pressure, 120/80. Well, that's the pressure that your heart is exerting on all your blood vessels. Now, the pulmonic side or the pulmonary side, that's blood coming what? Coming back to my heart. Is that high pressure or low pressure? It's kind of low pressure. But the blood going back out into the world, is that high or low? That's high. So think 120 millimeters of mercury, think that's what? Systole. Diastole is when the heart is filling. So now you know why. If you have a blood pressure of 150/100, is that a good thing?
That means
No.
it's filling at 100.
That means it's filling a lot harder than it is, and now it has to push out a lot more. Therefore, increased blood pressure, both diastolic and systolic, means your heart is working harder on both ends. That's why a lot of cardiologists, they get more excited if the diastolic is increased. Or 120 over 80 is your typical normal blood pressure. 120 minus 80 is 40. 40 is the pulse pressure, or the difference between the top and the bottom. If the top and the bottom start getting closer and closer, that means what? Your heart at play, or your heart pumping, is starting to look a lot like your heart at rest. That means there is no rest. So who's my patient who had really bad hypertension? 210 over 170. 210 over 180. Pulse pressure is what, 30? Right? He used to get these dizzy spells. He's driving the, and then his whole world will turn upside down. He thought it was an inner ear infection, right? Oh, by the way, non-obese. Non-obese, coming in thinner than I am. Then I took the blood pressure and it was what? Skyrocket. Then the next thing I asked, do you drink coffee? Oh, lots. And he goes, okay, what else do you do? Oh, I do recreational cocaine. Okay. So now what we got? Now I got a bigger picture. Now the heart is doing what? Working too hard. And that's why we don't like blood pressure. Because now, if all that 180 millimeters of mercury is now going to the systemic, what's going to happen to all my other organs if the pressure is too high? Don't you think they'll break, especially your kidneys, especially your liver? It's going to do a number on it. And no one likes that. No one likes that. So let's now go to, again, these are medical terminology stuff. Bradycardia means slower than 60 beats per minute. Tachycardia, greater than 100 beats per minute. Ectopic, the word ectopic, ec means like X. What did we do with our X's? Kick them out. Now, here's the problem. With an ectopic pacemaker, your pacemaker is supposed to be in your right atrium. Now, it's going, now something else is telling your heart to do stuff. And that's not a good thing. And typically, probably has a history of a heart attack and is now messing everything up. PQRST. See? It doesn't take training to know that this is normal because it looks even, doesn't it? And the P wave matches up to atrial depolarization. Now, what does depolarization mean? The easiest way is depolarization means doing work. So when my atrium are pumping, aren't they doing work? But what does depolarization really mean? Remember we talked about the ions? We talked about plus and minus, yes? Do you guys know what a 9-volt battery is? If I put my tongue on the negative side, what will happen? Nothing. I put my tongue on the positive side only, what will happen? Nothing. But what if I took that 9-volt battery and I put my tongue on both sides, plus and minus? I'm gonna get zapped, right? Same thing with your, jumper cables. You ever mess with jumper cables? Right? My kids always love the sparks. So one's a plus side, one's a minus. If I'm holding it like this apart, do we see any sparks? But if I put them together, you see a lot of sparks. So what's depolarization? D means no or not. Polar means what? Opposites, right?
Yeah.
If I depolarize something, that means I'm taking the opposites and I'm putting them together. If I put them together, what am I going to get? I'm going to get a spark, I'm going to get a zap, I'm going to get contraction. So P wave means atrial depolarization. QRS, which is not just one wave, it's 3 waves. That's a complex. That is depolarization, my ventricle. And you see how big? Remember my atrium was a little small? My ventricles were what? Big, thick muscles. So it makes sense that it's going to take way more electricity. QRS. So that's atrial depolarization, atrium doing work, ventricle doing work. Now what's T? Remember we talked about systole? Your heart needs what? A rest, a recharge. It can't be just beating all the time. That's why tachycardia is never a good thing, right? That's why any sympathomimetic drug like meth or cocaine is not good, because what are you doing to the heart? You're not making it less, you're making it even go faster. It needs a break. So that's what the T wave is. T wave is ventricular repolarization. What's it doing to the ions? Separating them for a brief second. for approximately 3 milliseconds actually. So PQRST. Now, you may be asking yourself, all right, Dr. Garais, I see the ventricular repolarization, the ventricular depolarization. What happened to the atrial repolarization? When does the atrium get the rest? Inside here. It's hidden. It's hidden inside the QRS. So P wave, atrium doing work. QRS complex, ventricle doing work. T wave, I gotta rest, I gotta recharge. What does heart attacks happen? T wave. You'll see STT changes and an inverted T wave because your heart isn't resting. It's damaged. You see that? You stop the ECG trace, move on with your day. Systole, contraction. Diastole, relaxation or filling of blood. Lub dub, this is your S1, AV valve, S2, semilunar. We already talked about that. Now you learned last term that muscles need a nerve to control it, yes? Right? The nerves in my armpit are controlling my fingers. I cut it, can I control my fingers? No. Now, we know also, in order for me to control my fingers, I have my area 1, 2, 3, parietal motor complex, sends a message down here and makes it do what? Do stuff. So what is the part of the brain that controls my heart? It is the medulla oblongata. Right? If you remember, what's that movie with Adam Sandler? Was it Waterboy? So the medulla oblongata. You have ANS is the autonomic nervous system. Did you guys go through autonomic nervous system last time? Or, all right? So I see some of you shaking head. So so explain to me what's sympathetic versus non-sympathetic. What's sympathetic nervous system?
Flight or flight.
Right?
Oh, yeah.
Fight or flight.
Yeah.
So what happens to my blood pressure? Increase or decrease? Right? Of course, increase. Now, in the autonomic nervous system, right, you either have choices of your heart or your stomach. Fight or flight, are you thinking of a ham sandwich? No. So it's all what? Cardiac. So sympathetic nervous system will accentuate or stimulate the medulla oblongata. Now, what's cardioinhibitory? The parasympathetic, because if you have sympathetic, what's parasympathetic? Feed or breathe, right? So when you're having a lovely meal, should your heart rate be up? No. And also, if you're in the mood for love, right? And you want to get an erection, should you be excited? Like you would be, yes, you would be excited, but not in the sympathomimetic realm. For example, a pit bull is chasing you. Do you start thinking about, hey, I think I should have an erection because I think it'll be really fun to have sex right now. The last thing you're thinking about is what? Sex. But when you're relaxed, parasympathetic state, what? You're in the mood for what? You're in the mood for love and you're in the mood to eat. So let's look at the two states. I take cocaine. What's going to happen? Sympathomimetic, increase of heart stuff, decrease of GI. Because you're doing cocaine, well, I heard, right? You're doing cocaine. Do you want a ham sandwich? No, you do not. But I smoked a whole, well, no, nobody smokes anymore. Let's say I had 300 milligrams, which is a lot, of some gummies laced with tetrahydrocannabinol, which is the active ingredient of weed. What's going to happen after you ate those gummies? First of all, you might freak out a little bit because you might be higher than you've ever been. But right after, what happens? Once you feel amorous, like, hey, that's my girl, where's she at? And number two, does she have cookies and or ice cream? They're all controlled by your autonomic nervous system. Auto means self. Do you have any control over it? No, that's why when addicts come into your house, into your ER, right? Let's talk about my friend Joshua. I never talked about you guys because we never talked about the autonomic nervous system. 23-year-old grad student, Joshua. What do drug addicts look like? Me and you. They look like me and you. Not a darn thing wrong with them. But what did I notice? Smacking. Because how's your salivary? Your salivary gland isn't activated, so you're gonna have what? Dry mouth, cotton mouth, right? 23-year-old male, not obese. Why is his blood pressure 200 over 180? He's sweating. It's the middle of February in New York City. It's about 20 degrees outside. He's sweating bullets, right? You know when you're so nervous that your upper lip sweats? And he's like this. This is exactly what he looks like. He's sitting there in a cardigan, just like this in my ER. Dr. Garais, I have no idea why NYPD has to be so racist on me. Because I didn't do anything wrong. I may have taken some things. And I go, you are running through Macy's naked, throwing bottles of perfume at everybody. And he goes, I just had to defend myself. And he's talking to me like, I'm showing like this. Like the nicest, sweetest fellow. And meanwhile, I'm stitching up some poor counter girl because she had 5 stitches in her head when he took a large bottle and shoved it in her face. Because it's a pathomimetic. Does he have any control over it? No. And remember, you have to look at it from the perspective of the addict. If I took away food and water from you, what would you do to me? When you do anything to me, right? How many of the most macho dudes I know, how do you get your money? He goes, it's tough. And then I go, so you're not homosexual? And he goes, no, but you know, yeah. He goes, I could do something for you, Dr. Garais. And they're like, excuse me? He goes, yeah, we just go in the back room there, and, you know, I can satisfy you. And he goes, just let me go. No, Josh, I'm not gonna let you go. He turned into a very belligerent man until what? Because he's gonna be what? Very charismatic. He's gonna want to do everything. Oh, he's kind of good looking kid, right? So he hits on what? Everybody. And he's been doing that for years. Claiming he was a grad student at NYU. We checked later. He wasn't a grad student for years. He just trolls around NYU for customers. And I've known him for years. I even knew him when I was in EMS. He's been doing it, and he looks and acts just like who? All of us. So do not be fooled. Use your autonomic nervous system powers. Look at if it has descended neck veins, right? Are they playing with their hair? Are they playing with a pen? Are they nervous for no reason? These things. Or the exact opposite, parasympathetic. Are they hyper relaxed, even when they're already being handcuffed? Right? And you'll see what I mean. Have you guys ever like went to, and I always say Walmart because I always get into trouble in Walmart. You go into a Walmart, not this one here, you gotta go to the one in Fairfax. That's real Kookyville, where I live. Right? Have you ever met somebody and they're just off? You know? Like they say all the right things, but they're just a little bit off. Like, hey, how you doing? Someone goes, I'm doing good. Yeah. And you're like, that person said the right things, but why is he making way too much eye contact with me? And you ever meet a close talker? Right? Like, hey, how you doing? He goes, hey, Matt. And you're like, hey, what? And he goes, no, I just want to talk to you. And I'm like, no, it's okay. You can go over there. Right? Because what happens to your autonomic nervous system if you're on an illicit substance? The autonomic nervous system will take over. Contraction, relaxation, we got that. We have coronary arteries. We got that. Now, this is important to know, and also we're going to have some lucky person in here will do a myocardial infarction. So what's an AMI? Acute myocardial infarction. Remember we saw this? These coronary arteries? They're from here, the aorta. They feed my heart. But what happens if I block one of them? If I block one of them, right? So I have a thrombus or an embolus, I block it. Can blood now go to where it needs to go? So what's going to happen in the end here? It's going to die. And when it dies, it releases a whole bunch of enzymes, and those are your cardiac enzymes. It's the reason why we have to keep our patient for like up to 36 hours and more, because we want to measure the level of damage. So an infarction, I want you to think blockage. Now, are we so scared of the infarction? Yes. But what are we really afraid of? I'm afraid of the sequelae. What happens next? No one dies of a heart attack. No one dies of an AMI. They die of heart failure secondary to an AMI. And what's heart failure? Heart failure is the heart's inability to pump blood to where it needs to go. And when you can't pump blood to where it needs to go, your body it's called shock. You guys ever hear that term? Like, oh, patient's going into shock. It's not like they're like being zapped. It means that the cardiovascular system is breaking down so quickly that we can't get oxygen in fast enough, and we can't get the carbon dioxide fast enough. And a myocardial infarction typically happens in the systemic side, typically left ventricle. Now, what's congestive heart failure? Also known as cor pulmonale. Congestive heart failure, right? Again, why do they have this backwards? Cor pulmonale, or congestive heart failure, is, well, yeah, in a way, you could do that. But cor pulmonale is a specific type of congestive heart failure, which affects the right side of the heart. Remember I mentioned, like, if my patient has COPD or chronic obstructive pulmonary disease, like emphysema or chronic bronchitis, don't you think they're going to have heart problems too? They will, but the heart problems will start on what side? Right side, because your right side is your pulmonary side. So overall, we're not afraid of these murmurs, coronary heart disease, right? We're afraid of the sequelae. What happens next? And what happens next is what? Congestive heart failure and then shock. And that's the bad thing that happens. Coronary artery disease, you can have, now, these look really close. Remember, I had this question on medical terminology? Messed up a couple of you. Arteriosclerosis. Arteries are doing what? If something's sclerotic, it's hardening. And if they harden, they won't flex. And if they won't flex, what happens to your blood pressure? It'll increase. Have you ever taken a blood pressure of a child? It's like what? 80 over 60? Because a child, their arteries and veins, it's not gummed up with beer and nachos. Not yet, right? So they're very flexible. So do you ever see children play? They play at top speed for hours. Because why? Their blood pressure and their blood vessels are malleable. They're very flexible. But in an adult, right, you have hardening of your arteries, not a good thing. Now, what can make hardening of the arteries even worse? Atherosclerosis. Athero is plaque buildup. There's inflammation. Remember we talked about how in your entire body, there's pieces of your body that break down and make a wound and make a hole, right? And then we have to have a thrombocyte or a platelet plug up the hole. Well, when you get older, the holes get bigger and worse. And when they get bigger and worse, you have not only platelets to plug up the hole, you also have inflammation to gum up the area. Well, that inflammation combined with fat, combined with salt, combined with sugar, will make a nice thing called a plaque, not a plague. Because if you had plague, oh, that's not a good thing. So plaque, P-L-A-Q-U-E. So that's fat. And here is a theme in your body. Anytime you have damage, your body likes to like spackle it up with fat, because fat's got a lot of energy. So you can give, the white blood cells some chance to, to heal up that area. But the problem is, over time, the fat will harden. Anyone here do any baking? No, I'm the only one. Yeah? I'm the only one who makes my own baked goods. Oh, it's nice to know. You know the crumble on a really good apple pie or a coffee cake? You know that crumbly stuff? You know what it's made out of? It's made out of Crisco, which is like pure fat, right? Shortening is the best, right? Salt and sugar. You put it in a bowl, you mix it up, and it makes a crumble, right? And it becomes hardened. Don't you think that's exactly what's happening with the atherosclerosis? Right? Oh, by the way, I make the best pie crust because it's made out of what? Fat, right? And I put a ton of salt, ton of sugar in it. When you go to the restaurant, that's actually what you're paying for, right? You ever have takeout? I'm not takeout, but you get something from the restaurant, right? It tasted great at the restaurant, and you take it home, and then it all congeals. Then it tastes like what? Garbage. Well, it's the chemistry in all the chefs. They know that. And it forces you to do what? Come back. Now, remember I showed you that video of the heart, and it had those yellow nerves? You have your SA node and your AV node. Now, the one you need to know is your SA, or your sinoatrial node. It's a group of nerves that are located in your right atrium. Okay? Now, these nerves control the pace of your heart. And the SA node goes about 100 beats per minute. Right? Now, from what we read, isn't tachycardia 100 beats per minute? So something has to slow it down, right? So you have the next thing is called the AV node. So you have the SA node, that's the pacemaker. So it's going to turn this into this. And something has to slow it down because remember we saw the lub-dub? There were little pauses, weren't they? To slow your heart down. And by the way, the more you do cardiovascular exercise, no matter what it is, it doesn't have to be running because running is really boring. But pick something like dance, something where you're using all your major muscles. And dance is wonderful. Going in the pool, swimming, but anything that will get your heart rate up, because the benefits are, and I shared with this with the previous class, the Garais family. Every Garais male has had a heart attack except who? Me. The youngest one was what, 19, 20 years old? Not obese. My nephew had a heart attack a couple summers ago. Why me and my second trimester belly don't have a heart attack yet? Because what do I do every day? I get on that treadmill, whether I like it or not. What am I doing? I'm letting my SA and AV node work out. That's why every time I take an EKG, it's always bradycardia. My standing heart rate when I was in medical school was almost 99, 98 beats per minute. That's the upper end, because I'm stressed out, I don't work out. But if you take relatively good care of yourself, my standing heart rate is what now, 58, 57, something like that. So when I go to the cardiologist, yeah, my sugar's bad, but my blood pressure is awesome for my age. I have no meds for my blood pressure. I've had pre-diabetes for the last 4 or 5 years now. My mom has pre-diabetes for the last 25 years. That means she's never progressed to what? A full-blown diabetes. If you can monitor, if you see something wrong, what can you do? You can prevent it. What do you think killed my father, my uncles? Diabetes, heart disease. So I learned the lesson. So 6, 7 years ago, I did what? Got to stop eating Doritos so much. Even though I say I eat Doritos a lot, don't eat a lot. Even though I talk about drinking a lot, do I drink anymore? No, I haven't. I don't really drink the last 10 years plus. And it's so funny because everyone in my youth remembers me as what? Frat guy, drinker, right? So now everyone looks at me. Did something happen? Did you have an intervention? No, I just wanted to live. And I just wanted, and also same thing with smoking. Ask anyone who knew me when I was a kid. I always had a cigarette in my hand. I never smoked like lights or whatever. I went right to Marlboro Reds. And then after that, in college, for 5 years, I smoked those Turkish cigarettes, the Class C cigarettes. They have no filter and maximum tar. all day. But what happened? When I had more knowledge, I started saying to myself, even though I enjoy the heck out of this stuff, what do I need to do? I need to stop that. And also, what kind of doctor would I be? Imagine I'm there smoking in the parking lot. I go, you really should quit. You know, you shouldn't drink and stuff. I'm going to be at the bar across the street. Like how, you know, that's being a hypocrite. We already went to sympathetic, parasympathetic, and blood contraction, and now we kind of know. All right. So right now, let's look at. Let's see if we're missing some of this. Oh. Okay. This will probably be for Thursday's lecture, right here. But you can answer systolic, diastolic. We already have the valves. Pacemaker, remember SA and AV node. And remember, SA node is the pacemaker. The AV node is the brakes. Because remember, the SA node is too fast. You want to slow it down. And that's why when a patient gets a heart attack in the area of the AV node, they get SVT, supraventricular tachycardia, because then you have no brakes. What happens? You got no brakes in your car. You'll go what? 210 beats per minute, and that's never a good thing. You know what? We got some time. So let me explain, because it might help you here on this part, on the valves. I'm looking around. Did I answer everything? Yeah, it will also help you here. Types of blood vessels. Again, these are the types of blood vessels, and we'll continue that on Thursday's lecture. I don't want to creep into Thursday's lecture. But I want to help you out with something like this, because when I was doing the valves, I'm seeing some of you check out, and that's normal. That's actually how most people react. You know what? How's this? I'll show you my video of
Actually, Professor, before you do the video, can you go over the blood types again? I'm so confused on that.
oh wait. Which one? This one?
Yeah, the people with the universal donor.
Oh, that. So let's review this one. 21. People with the blood type goes who are universal donor. Donor is what? O, right? So type O, because does O have anything on it? Does O have anything to start trouble with? They don't have any jackets. They don't have any antigen. So if I don't have any jacket, I could give it to anybody because it won't start trouble, right? So if I give an O to an A person, they'll be like, okay, because there's no jacket. I give an O to a B person, they're like, okay, there's no jacket to start trouble. I can give an O to what? A B, because they have all the jackets, you've got no jackets. So they're not going to attack you, right? But I can't give A to a B because what's on my jacket? A. I have A antigen. B has what? A antibodies. So if I give A blood to B, you're going to get serum sickness because then the B will attack the A and vice versa. Now, who are the people with the blood type who can receive only one type of blood? Of course, it's what? Either A or B, because A can only receive what? A. B can only receive B. Well, also universal donor as well. And universal recipient, of course, is what? AB. So those are classic questions. So the review, universal donor, type O. Universal recipient, type AB. And people with the blood type can receive only one, either B or A, when you're not looking at type O. And of course, you can look up what mismatched blood is. I already said the words, serum sickness. Because if you have agglutination, if you have a fight in your blood, you're going to get sick. Okay? That's a good thing right here. Let me help you with this. And if I go to YouTube, let me sign in, or and then we'll take a quick break. The password is, I don't know. And you could look up a whole bunch of stuff. For years, I've been putting things on YouTube. See if it lets me in. Guess it's me. My videos and ignore this guy. I miss him so much. He was awesome. That was the last time I went in the ring, 12 years ago. I was in Vegas at the tap out at their tap out facility when they first opened it. I lost horribly. I think like 5-1. And that's the before picture. I was all like tough, like black eye, missing a tooth. What is it? Cardiac cycle, or the box. Oh, here it is. So let me play you this. Oh my God, it's so. And you can see when I was with the other place. Oh, that's sad. So this can help you with structure and dealing with a picture like this. Now, the box diagram is a diagrammatic, like kindergarten version of that crazy picture of the heart. It's very hard to memorize that crazy picture, right? But I can tell you, all throughout undergraduate and even graduate school, all we ever did was memorize that nutty picture. Until we met Dr. Kagiwa in second year medicine, who told us we're doing it all wrong. And he showed us things like this box diagram to simplify the complex. Because isn't that also partially our job? If you can explain things to your patient as if they're a 10-year-old, but without making them feel stupid, then you're doing your job correctly. Hurry up. So broke. So what I'm drawing there is a big plus sign. The little boxes on the top are your atria, of course, and the big boxes, or the long boxes on the bottom, are your ventricles. And remember, where's the right side? And where's the left side? So just this side alone, what kind of more even advanced questions could you ask? And also, you're looking at the heart diagrammatically. So if I ask you, what is the AV valve on the left side between my left atrium and left ventricle? It's easier to look at this versus that complex heart, the one with all the arrows. Then I would be asking what? What would it be? What's the AV valve on the left side? This is an atrium, this is a ventricle. And I drew it with how many doors? 1, 2. So the bicuspid, also known as mitral valve. You could also ask, your left ventricle, is it oxygenated or deoxygenated? Oxygenated. Aorta, oxygenated or deoxygenated? Oxygenated. Therefore, when I look at a diagram in my textbook, I know what's the left side because it's what? Oxygenated. Left side is what? Systemic. And my aorta, even though diagrammatically I put it down here, I separated it. Now I have what? Remember the lub dub? This has to close first, then this closes second. So this becomes lub dub. So your S1 coordinates with what? The closure of your AV valve. S2, closure of your semilunar valve. Now, let's expand that. Everything goes out in the aorta, out the aorta. Your body uses everything up. So if it uses up all the oxygen, what do you have left as waste? Carbon dioxide. So then everything on the right side is what? Blue. SVC, superior vena cava, superior coming from my head, inferior coming from the bottom. Empties into my right atrium. How many lines did I draw here? 1, 2, 3. If this is bicuspid, this got to be the tricuspid. Going into my right ventricle, going into my pulmonary semilunar valve, going into my pulmonary trunk, pulmonary artery, ending up where? My lungs. So when you look at this, let's look at the final picture. Things from my lungs have to come back, and that's my pulmonary vein, because remember, things coming back is venous blood. Things going out is aortic. And we're going to learn on Thursday a little bit more about how that works. But you see how this is, well, maybe not today, but if you practice drawing this a couple of times, then let's try to answer this. The valve between my left atrium and left ventricle, what is it? Bicuspid, also my mitral valve. What's the next one? The valve separates the left ventricle from the exiting vessel. So what's exiting my left ventricle? Left ventricle, what valve is this? Aortic semilunar valve, emptying out into my what? Aorta. So do you see how when you look at something diagrammatically, you look at the box, it's 10 times simpler than this. But what did we do when we were in medical school? We just did what? We just memorized this or this. How complex is this? This is like, you don't know what's going in, you don't know what's going out, right? But now that we saw a little bit of the box diagram, so if I'm looking at this, is this the right or the left side? Left. So, and you can see there's oxygenated vessels here. So this has to be the left what? Atrium. What's in between the left atrium and the left ventricle? Diagrammatically, it was what? Mitral valve, also known as bicuspid. If that's the mitral valve bicuspid, then what's this have to be? Tricuspid. Right? And you see the semilunar valves, they look like this, they look like little cups, little ashtrays. If this one's blue, it's coming from my right side, that's gotta be what? Pulmonary semilunar valve. This one's going up under into my aortic arch, that's gotta be my aortic semilunar valve. I drew two tubes going into my right atrium, one coming from the top, superior vena cava, one coming from the bottom, inferior vena cava. So you could see how, once you figure it out diagrammatically, you extrapolate it to this. Any laboratory exam where the difference between this class and the RN class, it's the same lectures, the same everything, but the difference with them is on Fridays, they got to go to the lab and they got to look at this for real, moving in the anatomage, and they have an oral examination every week, right? Where they have to, there's no labels or anything, they have to do what? They have to pick all the stuff. But right now that you know the diagram, you can do the same exact thing. And that's why I'll show you exactly how it can be done. And what's even better is that now this, which could have been a nightmare, right? For you memorizing what's up, what's down, what's semilunar, what's not, what's a mitral, now you know exactly what a mitral valve is. Now you know exactly what an AV valve is. So now this becomes what? Child's play. This thing here. And next Thursday, I'm going to show you a diagram of this down here regarding the differences between arteries and veins also becomes child's play. Because if you look, remember, people, I can yap all day, but people are more what? Visual. No one's, I think 13% of the world's population is an auditory learner. Most people are what? They're visual. And everyone's kinesthetic. So if we have some time and maybe if the laboratory is open, I would love for you guys to mess. That's why I kind of shoved all the lectures heavy on Tuesdays. So that Thursdays we can do homework, so that in the weekend, what will you be focusing on? Quizzes, exams, acing them, so that you don't ever have to see me in this class ever again. And of course, what's the more important part, that you get all that stuff in your head moving onward and upward. All right, it's 12:09. Let's take a good 10-minute break. Let me put my timer, and then we can let's do the pre-practice quiz. See how that thing turns out. Okay, where to go? Ooh, this one's better. Oh.
Are you gonna be doing like the quiz reviews